Dr. Chalmers, and this is Wellness Insights with Dr. Chalmers. Today we're going to be talking about B3. A lot of people don't know much about the Bs except for B12 and the energy. So I kind of wanted to go through some of these and go and chat about the importance of what some of these vitamins do. Niacin, or B3, takes a couple different forms: nicotinamide, tryptophan forms, nicotinamide adenosine dinucleotide, or NAD. A lot of people have heard about NAD, NAD plus, or the NADP, which is NAD phosphate. These are really powerful, really helpful chemicals for cleaning the liver and for kind of resetting how the body functions. A lot of people have talked about how testosterone will mess up cholesterol levels, and high dose testosterone can do that because it depletes the body of niacin. So again, when we start looking at the body and we start seeing that things are not going the way we want to, we shouldn't say, well, it's a mystery, I don't know. We need to start thinking, what nutrients are being used up? What deficiencies do we have in just chemistry? Because health is bad chemicals out and good chemicals in. It's all chemistry. So if we can figure out, hey, we have this issue over here, if we start saying, what deficiencies does the body have that keep it from running the way it's designed to, I think we're going to be a lot better off than just saying, oh my gosh, it's a mystery. How can we figure out how to find a drug to give this to offset the symptoms? So I kind of want to go through some of the stuff that B3 does because I'm a big fan of B3. I use it in a lot of my protocols, especially high dose, to kind of clear up a lot of stuff. So niacin's known for being pleiotropic, which means that it affects multiple codons, epigenetic codons, and it can change more than just kind of one thing at a time. So epigenetics kind of takes us back to the idea that just because our genetics have, tell us that it's going to go left and right, we have epigenetics, which kind of sit on top of that and say, well, we go left unless this happens, and we go right unless that happens. And so we can direct our genetics just a little bit. So that's what we're starting to learn about with epigenetics, is that we can actually change some of the genetic function that we have. So niacin's both neuroprotective and can cause neuronal death. So we've got to be kind of careful with how we're using it, when we're using it, and where we're using it all around. So do make sure that if you're going to start playing with this, that you do it carefully, and you do it with somebody who knows what they're talking about, because it's kind of easy to go good and go bad. But then again, that goes back to my old saying, nothing's strong enough to do good. Nothing can do good without doing bad. Anything strong enough to help can hurt. So keep that in mind. So niacin's been shown to not only reduce all the bad cholesterol in your body, but can also increase good cholesterol. So when I talk about using this to clean the liver, that's what I'm talking about, because of course cholesterol is actually created in the liver. And so if we start worrying about cholesterol, we have to talk about the liver, because that's where it's made. It's the factory for cholesterol. So one of the quotes that I pulled from the research I wanted to give you guys was, niacin has seen extensive use alone or with combination with statin medications, coenzyme A, reductase inhibitors, that type of thing, in a reduction of total cholesterol, total triglycerides, low density lipoproteins, the LDLs, very low density lipoprotein, the VLDLs. That's where a lot of the new research is. It says the VLDLs are worse than the LDLs, and total lipoprotein levels. Moreover, niacin is the most potent agent used to increase plasma high-density lipoproteins. Those are the HDLs. Those are the good ones, or the quote-unquote good ones. In patients with diabetes mellitus or mixed dyslipidemia, niacin has demonstrated clinical trials that it can counterbalance cardiovascular risk in this patient population, decreasing cardiovascular morbidity and mortality. So basically what this is saying is that if we use niacin properly, we can adjust the cholesterol levels, we can decrease heart attack and stroke risk, and we can really help the blood vessels in people who have diabetes. So, if we're looking for a tool to start battling arterial sclerosis, plaquing. If we're worried about heart attacks and strokes, you know, getting high levels of niacin in is a great way to start treating some of the problems that we end up seeing. So now, like I said, there's a bunch of different versions. So typically, nicotinic acid is used for hyperlipidemia. So we need to kind of watch, if we're looking for which form to use. Nicotinic acid is generally the one we're going to use, nicotinamide, mostly for nutritional support. Um, and, correcting issues of what's called pellagra, which is basically no niacin, low niacin levels. So the things that we typically see associated with niacin deficiency, cardiovascular events, obviously, premature aging, and obviously that one's going to take effect because anytime the liver gets dirty, gets dysfunctional, whatever, we see it in the skin. Acne, wrinkles, drying, the age marks. The skin's not necessarily wrinkled, but it looks like leather, and you're just like, wow, you're old. That type of stuff. Again, we're going to see that from a variety of reasons, but lack of niacin is definitely going to be one of them. We also see a lot of neurologic issues, Alzheimer's, Huntington's, ALS, muscular atrophy, Parkinson's, that type of stuff, and even some of the cancers like squamous cell and that type of thing. We're going to see a lot with low niacin levels. But we should kind of expect that, right? Because the liver is the number one filter in the body. And so if we can't pull out the inflammatory issues, if we can't pull out the chemicals that are creating damage, then we're definitely going to have problems all over the body because it becomes systemic, right? The liver's the thing that ends systemic inflammation. So the cleaner the liver, the cleaner the body. And this is one of the big pieces that we use to make sure the liver stays where it's supposed to. So you can actually shut down the overproduction of cholesterol by increasing niacin levels. So the theory is that the body is supposed to make cholesterol, obviously, because that's how we make all of our hormones, but it can overproduce it in the same idea, not the same way, but the same idea where cancer is just an way overproduction of normal cells. The body produces way too much cholesterol as the liver starts kind of going all wonky and as a result of low niacin levels. So keeping the niacin levels in the right range is really important. Now, remember, the right range for anything is very self-dependent. So what's the right range for me, for you, for your sister, for, Aunt Becky? All totally different levels. And so that's the thing we kind of have to recognize. If we have issues, symptoms, we have blood results, muscle testing, if we have something that says that you need more than the RDA, then that's okay. Whatever the government says isn't always best. In fact, 99% of the time, it's not enough. But that's just kind of where we're at. So if you feel like you need more than other people, don't feel bad about it. Don't freak out about it. Don't think that that's necessarily wrong. You very well might need 5, 7, 10 times more than, one of your friends. So we're all just kind of in a different boat. So keep that in mind. We've also been able to see, kind of back to what we're talking about with diabetics. Niacin has a way of showing that it reduces and reverses insulin resistance. So insulin resistance would be where we have a ton of blood sugar and we're producing roughly the right amount of insulin, but the body doesn't recognize the insulin and it's not utilizing it enough. So we can make the comment that either the receptor sites are blocked or they've been what's called down-regulated, which means they're still getting hit with the insulin, but they're just not working as efficiently. So that's a really, really important piece is that, as we start adding back in niacin, sometimes we'll start to see insulin resistance, metabolic disorders and things like that start calming down. Now, I'd like to throw a little piece of this out there just as a heads up. If you're using medication to increase insulin function and you decide, hey, I'm going to start throwing a bunch of niacin in my body, you might want to watch that because if you have insulin resistance and you're taking medication for it, then you take a ton of niacin and the niacin helps fix the insulin resistance issues, you can end up having way too little glucose in your system because your body sucks it all in because all of a sudden you went from a little bit of insulin function to a whole lot of insulin function overnight. And so do kind of play that in. So if you guys are on medication, if you guys are working on getting your insulin function back up, and you decide, hey, I'm going to start throwing a bunch of niacin at this, make sure you talk to your doctor and make sure you guys work on it together so that you guys don't push too hard too fast. So that's a really, really important piece. So niacin, as you know, obviously the name implies, helps create NAD, which is nicotinamide adenine dinucleotide. Sorry. And NAD was first shown to start reducing damage of aging because it helps repair DNA from a number of different ways. Without NAD, the body cannot grow or completely and properly undergo mitosis. So, that's where the cell divides. So, what we'd see is that the cell is supposed to divide into two equal cells that then kind of carry on their own little thing. Well, what we were seeing in people who didn't have enough NAD is that they would divide, and one cell would be pretty good, and the other cell would not be very good at all. Not as a knock to Danny DeVito, but think of the movie Twins, where they were supposed to be twins, and one was Arnold Schwarzenegger, and the other one was Danny DeVito. So one cell was awesome, and the other cell was not as awesome. So that's kind of the idea of what's going on without the NAD. And so increasing the levels of NAD and NADP really helps those cells to divide properly. And so when we talk about aging, a lot of times people think, oh, I look old, I feel old. But in this case, this could actually be one of those things where we start having organ failure. So if the heart muscles divide a whole bunch, if the muscles in the blood vessels divide a whole bunch, if cells in the brain divide, but they don't divide properly, we're going to have problems as we go along that could end up creating substantial issues for our health long term. So the NAD is very, very important. So the other thing, and I know people are going to get sick of talking to me talking about this, but I don't really care. The NADs really help to reduce free radicals, or as we all know, free radicals, the other name for them is reactive oxidative stress, or ROS. So this is another big piece, because anything I can find that'll help the body reduce ROS, I'm 100% on board with it, because the free radical damage that we have, that's the main piece of aging. Whether you want to look at it from a how do I look and feel standpoint, or am I going to die from a heart attack, stroke, or cancer, free radical damage is really, really dangerous, and we got to knock that out. So we got to get the antioxidants in. We got to get the support and the repair for ROS, and NAD and niacin are really, really important for that. So we got to make sure that we get those things put back together. The other thing is, if we see a lot of people with fatty liver. Fatty liver is obviously something we really want to avoid, because that shows damage to the liver, or at least, if you don't want to call it damage, we can at least say that it decreases overall function of the liver. And niacin and NAD have been shown to greatly reduce fatty liver issues. So that's going to be really, really beneficial. It's also increased mitochondrial function all over the body. And so again, mitochondrial function is going to give us more metabolism. It's going to give us more ATP to run the heart, the brain, the muscles, get everything functioning. It's going to give us more energy. It's going to help clean things up. We're going to feel better, have more energy, be able to do more things longer. So again, this is one of those things we really, really, really need to push for and get as much in as we can. So, if you have, any of those things, muscle weakness, fatigue, high cholesterol and anything else, we really got to get your NAD up. And oftentimes we can just do it by just giving you tons and tons of niacin. That's really beneficial. The other thing is that, one of the worst cancers we can get would be like a glioma, like a brain cancer type of thing, and glioblastomas. So niacin's been shown to help reduce the formation and the growth of those type of cancers. So again, just more reasons to get that in. So, I do want to make sure that we go through and we cover the whole anything strong enough to do good is also strong enough to do bad piece. So when people have been taking large doses of this out, unchecked over a long period of time, we see a lot of people, they do reduce their cholesterol, but we start having diabetic issues. And so that's highly problematic. So make sure that if you're doing this, you're again working with somebody who knows what they're doing with some of this stuff, and you can kind of keep that in check. We see a little bit of increase in resting blood sugar over time. that gets cumulatively worse. So after a year, you're fine. 2 years, you're pretty good. 3 years, you might see a little bit. 4 years, it's a little bit more. And by 5 and 6 years in, you're, okay, now we're in a bad place. So what we can do is we can say, your cholesterol and your blood vessels and all these things are in a bad place. Let's fix them up. And then let's, kind of work on different things to keep the liver clean. And then you can cycle niacin through to kind of keep everything functioning. And then we can bring you back down to a lower level as like a maintenance kind of function. So the idea of taking 4, 5, 6 grams for a little while is fine, but you don't want to do that for a whole long time. So if you've been taking tons and tons of niacin, for 4 or 5 years, make sure you start checking your blood sugars, because that can be an issue we need to start dealing with. And again, sometimes we have people who have major issues, and so we need to stay high, but we balance on the other side. And so there's ways of balancing blood sugar raising, especially if it's slow. So we can still do that, but just understand that niacin is strong enough to do good, so that means it is strong enough to do bad. So one of the things that we see the most problematic thing we see, which is not really that big of a deal, no one's going to die from this, is what's called niacin flushing. So what happens is that the face and the chest and the shoulders type of thing start getting really red, and they get hot, and people, it feels like a hot flash type of thing because the blood rushes to the surface. This is oftentimes temporary. So if you have a really bad cardiovascular problems, this is something that you can just decide you're going to put up with for a little while, and it will calm down. The other thing you can do is, this is usually dose dependent. So what you can do is you can say, okay, instead of taking 2,000 milligrams or 2 grams all at once, I'm going to take 100, 200, 300 multiple times throughout the day until my body gets used to it. And then I'll slowly go up. And that's generally what we do when we start working with people, is we start them low and we see what their body can tolerate, and we slowly increase until we get to the therapeutic or the functional amount of niacin without any side effects like niacin flushing. You can actually use aspirin if you just can't deal with it, or you're in an emergency state. We have to push hard right now. A little bit of aspirin can knock this out. You take the aspirin about 30 minutes ahead of time, and the niacin flushing is really kind of calmed down. It's not that bad. You can at least deal with it. So that we should kind of see a little bit of ALT, AST levels come up when we're taking high dose niacin. Now remember, ALT, AST, it doesn't show liver damage. ALT, AST is aminotransferase. It's how many aminos are in your blood. And of course, if we're working on the liver, we should see ALT, AST levels come up. Now, here's the fun thing. We should be able to balance that if we're cleaning the liver out. So this is why when I do niacin work, we also do coffee enemas. We also do all this stuff to ensure that the bile is flushing out and things like that. So as we're using B3 and we're using the niacin, I like to make sure that we're using high dose fully methylated folic acid and B6 and the other host of methylated B vitamins to keep everything else the liver is trying to do flushing as well and cleaning out as well. So we generally can maintain not seeing ALT, AST levels get too out of hand. If we're doing the coffee enemas, if we're doing the other work on the liver, you don't have to do coffee enemas. It's just much easier and cheaper. But at the same time, we can keep ALT, AST function lower as we clean the cholesterol levels. Because remember, if you're cleaning out cholesterol, where's all the cholesterol in your blood have to go? It has to go through your liver. So it has to be cleaned out. So of course, your liver has to work on that as well. So obviously, there's going to be lots of function in the liver. ALT, AST levels are obviously going to come up. But if we're cleaning the liver out at a higher rate, your ALT, AST levels shouldn't end up being a place where anybody's concerned. That's kind of the biggest piece on that, is that, again, if we look at the body holistically, not just you have a cholesterol problem, we're going to throw niacin at it. If we go, you have a cholesterol problem, we need to help the liver out. Yes, niacin is going to help the liver out, but so is B6 and folic acid and histidine and all the things we need to throw at the liver to clean it. And so, yeah, of course, we need to work it holistically. So if you've got so there's certain people I don't want doing this, just like, oh, good idea, I'm going to start doing this. If you have active peptic ulcers, don't start this yet. You're not gonna love what happens. It's gonna hurt. Again, I always tell people, start with clearing the meridian pathways so the body can communicate. empty the liver and the kidneys, clean them out, then, kill any parasites, kill off the yeast, restore the gut so that the body can actually function and detoxify and get nutrients in, then start doing stuff like this. So this isn't something that you just hear and you go, oh, I'm going to start this tomorrow. No. Establish the foundation, make sure the waste can get out, make sure the nutrients can get in, because you have to balance everything else, and then you can get going. If you have a peptic ulcer, we got to fix that first, and then we can kind of go on. If you have active liver disease, so if your liver's actually all sorts of messed up, we kind of need to get that knocked out. If you have hepatitis A, B, C, we got to clean that and fix that first before we work on the liver. This should come as no surprise that if you have something going on with your liver, we need to fix that thing before we try to make a holistic long-term change. So, obviously liver damage should be one of those things. You always have to go through and tell the people, if you're hypersensitive to something, like if you for some reason your body just really reacts poorly to niacin, high dose niacin is probably going to be a bad plan. So just heads up, if your body doesn't respond well to niacin, maybe we need to do something, a different form of niacin. Maybe we need to do titrate it in differently. Maybe we need to do, something to buffer it. But if you have bad reactions to niacin, this might not be the best course of action for you. So, it's also possible that you can be sensitive to something in the supplement. So it's not just niacin, it's something that is a cofactor or something that goes with it, and we can desensitize you to it, or we can keep going on. There's just a number of other things that we need to work on. One of the ones I remember reading this in research and just thinking, oh my gosh, is it said, hey, if you have arterial bleeding, this might not be the best thing for you. Yeah, no joke. Yeah, there's a lot of things you shouldn't do if you're literally bleeding to death on the inside. Yeah, let's fix the bleeding to death on the inside first. That's literally, when you call a doctor's office and they say, if you're having a medical emergency, hang up and call 911. This is exactly the same thing in research. They're like, oh yeah, if your blood vessels don't work and you're literally leaking on the inside, you shouldn't do a liver cleanse. Yeah, no joke. You're going to die. Get your blood vessels fixed. So, I added that one in. I wanted to talk about that just because, sometimes I read stuff in research and I'm like, are you kidding me? Who decided that they needed to, say this? If you're on fire, put yourself out before you start taking a bunch of niacin, because, fire is more important. Yeah, obviously. Sorry, I thought that was hilarious. I wanted to add that in. So niacin can pass through breast milk. Again, don't do detoxes while you're breastfeeding. If you need to detox because you have too many heavy metals or you've got, all sorts of other problems, don't breastfeed. The idea that breast is best is kind of right and kind of wrong anyway, because if you're eating foods that your child is sensitive to, that breast milk is full of stuff that your baby is going to, find inflammatory. If you're nutrient deficient, your breast milk is being nutrient deficient. So it's not that breast is always best. And especially if you're detoxing, it is in no way a good idea. If you're on any other high, strong medication, it's not a good idea to breastfeed. You guys can snuggle up with your babies and feed them from a bottle and get the nutrients in your kiddos. Remember, same thing with babies, the same thing with adults. We have to get the chemicals in the body. So if the good chemicals aren't in the breast tissue and they're not in the milk, you're not going to get the good chemicals in the kiddo. If you've got bad chemicals in the breast tissue and thus in the milk, you're going to put bad chemicals in your kiddo. So let's think for just a second about what's coming out of our body going into the kid before we determine that breast is best. So that's a piece I like to make sure that we all kind of at least touch on. Now niacin is really good for brain function. As a neuro guy, as a brain guy, this is I'm a big piece of this. So the way that it works is niacin helps kind of form what's called cyclic ADP, or ribose and nicotinic acid, ADP. It controls intracellular calcium signaling. So basically the way that the neurons talk to each other, there's a big piece of this with this ADP. It's really critical for nervous system function, so the way the brain actually communicates. And you can see this in the deficiencies when we have low niacin and the problems that are created. So, like we mentioned, Alzheimer's, Huntington's, ALS, which is amyotrophic lateral sclerosis, musculature atrophy, Parkinson's, those type of things. I mentioned this earlier, and I want to kind of go back through this. Niacin deficiency creates what's called pellagra. It's defined by what we call the 4Ds. So dermatitis, which is inflammation of the skin. It looks kind of like psoriasis almost, but it's kind of all over the face. You see this in kids, like they're all like the cheeks and everything. Dementia, so our brain just doesn't work right. Loose stools or diarrhea, and of course death. Because if your brain starts falling apart and you have diarrhea too long, which dehydrates you, all the problems get worse, and then you die. So that is a thing. It would be very hard for someone to get full-on death from pellagra in the U.S., but just because you're not dying doesn't mean the quality of your life is where you want it to be. So the dermatitis that we see, like I said, the inflammation, it's a little unique. The way it's unique is that when the sun hits the body, it damages the body at a much higher rate. So people get sunburns that are much worse than they should be. And they last longer, and we see more skin cancer from them. And I believe that the reason for that is because the DNA repair is so much lower. When we get sun on the skin, the metabolism speeds up. And as the metabolism speeds up, we've got to have the building materials to actually allow these cells to replicate and divide and clean themselves up and function. So when we have, low ADP, then we're going to have a harder time for cellular mitosis. We're going to have a harder time for the cells to function, and the DNA is going to get damaged. I mean, we talked about that earlier, but that is something that's going to happen a lot. And so that's one of the reasons why we got to be very, very careful. Go ahead and feel like you can be in the sun. Just make sure that your nutrient levels are high enough to respond to the increased utilization of cellular turnover, and you're going to be a lot better off. So that's going to be the big piece. Is we have that UV radiation that our body has to have, because that's how we make D3. We also have to have enough nutrients so that the chemistry can run. So just keep your niacin levels up. So we talked about neurologic damage when we have loss of NAD+. It's a supplement. I'm sure you guys have seen it. But I was like, NAD+ is a great supplement to take. I want to take a sidebar and talk about that. If you guys are looking for something to take and you want to take NAD+, that's fantastic. I mean, I'm not going to knock that at all. I think it's a fantastic thing to take. However, I like to give the body all the substrates, as long as the body can do it. We have MTHFR issues, and so we have got to give the body fully methylated B vitamins, and that's just the easiest, best way to go. But I generally like to give the body all the substrates and let it go through its normal processes, because just because we know, hey, there's a chemical over here that we really want to attack, we really want to get, doesn't mean the body's not using these substrates and these these primary chemicals to make something else that we need that we're not focusing on. So I'd much rather give the body, especially in B vitamins cases, a whole lot of B vitamins all the time, because whatever it doesn't want, since B vitamins are water soluble, it'll just get rid of. And so, you might be like, well, yeah, so I'm spending $10 more a month that's just not getting absorbed. But okay, that's a question you're going to have to ask yourself. If I spent 10 cents, $10, $50 a month that I didn't need to, but I don't know how much I need. Sometimes it's $50 a month was wasted. Sometimes it's $30. We don't know how much our body needed in that time frame. So I choose to go a little bit higher. We muscle test everybody else. Besides me, I take a little bit extra. But that's one of the big ones. That's the big thing when we talk about NAD, low NAD from low niacin, low B3. The worry that I have is that we're not going to know we didn't have enough until it's too late. Until someone starts presenting with Parkinson's, Alzheimer's, dementia, things like that. And out of all the things I'm scared about, I would rather have a heart attack and die today than to lose my mind. The idea of getting Alzheimer's, getting dementia, that terrifies me more than anything. I'd much rather have a heart attack and die. I'd much rather get in a car wreck and die, boom, done, gone, than have my mind deteriorate, not being able to remember my kids or the first date with my wife, or just stuff like that. That's horrible. So that's the big piece, keeping your brain functioning. The fun thing about niacin is that it's used for a large number of chemical processes. Uh, that means that we use it up faster the higher the metabolism gets. So that's why I talk about with testosterone, because as we all know, testosterone, substantially increases your metabolism all over, which is why we lose so much weight, we gain so much muscle, we feel so much better, we have so much more energy. Our metabolism's higher. But again, higher metabolism, the faster we make stuff. So again, metabolism is, just the speed at which we make new cells. If we're making a lot more cells, we need a lot more nutrients. You make 10 cells a day, you only need a little bit of nutrients. You make 10,000 cells a day, you need a lot more nutrients. And so that's why as we start, asking for and demanding that we create more tissue, more cells, we need more niacin. So as your metabolism comes up, as you ask your body's metabolism to come up because you're pushing against aging and that type of thing, you're going to need more nutrition. And definitely niacin is one of the ones you guys need to get in. So if you notice that your cholesterol is not in the right place, if you do, if you do a calcium CT and your blood lipid levels, your blood cholesterol is okay, but your calcium CT is not, you can still use niacin to clean a lot of this up. Remember, niacin also it pushes against reactive oxidative stress and free radicals. So it's going to be a good one for that. Now, I wouldn't use a tremendous amount of niacin unless we're seeing the LDLs come down safely and stay in a safe place and the HDLs go way up, because the HDLs going way up is going to help break up and carry that plaquing out of the blood vessel. So niacin can still be used if we have a bad calcium CT. It's not the only thing I would use, but it's still going to be beneficial. So, I wanted you guys to kind of understand what niacin is and how it works. And so, hopefully now you have a little bit more appreciation. If you guys have more questions, you can obviously ask me. You can do your own research. But it's a beneficial nutrient. Now remember, it's still water soluble, so you can't take a whole bunch of it once a day and be like, haha, I've corrected the problem. 2 or 3 times a day. Now niacin is not one of those that's really, really big for creating energy. So I have a lot of my patients take niacin at night. So they'll take, morning, noon, so breakfast, lunch, dinner, and then right before they go to bed. Now, if it causes flushing, sometimes people go like, I can't sleep because it causes flushing. Then don't take it at night. Take it during the day. Put up with it. Take smaller doses all the time. Tell your body gets used to the niacin and you don't have the flushing. Then you can take a higher dose at night. But remember, this is the reason I have people take it at night. Our bodies repair, regenerate, and clean themselves at night, especially the liver. The liver cycle is between 2 a.m. and 4 a.m., typically in the United States, because that's when the times are set up. So what's going to end up happening is that if we can take the niacin at night, when we know the liver is going to be doing the majority of its work on cleaning itself, it's going to be able to help a lot more. And so that's why I give the higher dosages at night. But so it's a little bit on niacin. I hope I didn't get too in the weeds with you guys, but this is why I like this. This is how I use it. And so if you guys have any other questions, hit us up and we'll be able to help you guys get where you want to go. Thanks.